Here is a number that may surprise you. After 65, the risk of being harmed by the wrong medical checkup can quietly go up, not down. Not because doctors stop caring, not because checkups are bad, but because some tests start finding things that were never going to hurt you, and once that door opens, it can lead to more scans, more procedures, more fear, and sometimes more harm than help. And the hardest part is this. You can be doing what feels responsible right now, booking every test offered, and still be moving in the wrong direction without knowing it. That is why this video matters so much. If you are over 65, or you love someone who is, these 5 checkups are not ones I would book automatically just because of age. In many cases, the wiser move is not more testing. It is the right testing, for the right reason, at the right time. This is not just my opinion. Groups like the U.S. Preventive Services Task Force, the FDA, and the Choosing Wisely campaign have all warned that some routine screening tests in people without symptoms can lead to false alarms, unnecessary procedures, and very little real benefit. That does not mean ignore your health. It means be strategic. Be selective. Be smarter than the fear. And before we start, if this channel helps you make calmer, safer health decisions, subscribe. It truly helps these videos reach more older adults who need clear information, without scare tactics. And tell me in the comments your age and where you are watching from. I always love seeing how many people in their 60s, 70s, and 80s are taking charge of their health with wisdom, not panic. Number 1 is the full-body CT scan, when you feel completely fine. This one sounds so tempting, doesn't it? A scan that looks at everything. A scan that promises peace of mind. A scan that might catch something early. But this is exactly where smart people get pulled in by the wrong promise. A CT scan is a detailed X-ray that creates pictures of the inside of your body. It is an excellent tool when you have a real problem to investigate. But when healthy people without symptoms get a whole-body CT scan just to check everything, the FDA says there is no good scientific proof that the benefits outweigh the harms. Why? Because the scan acts like a smoke detector turned up way too high. Yes, it may notice smoke, but it also goes off for steam, burnt toast, and things that are not true danger. In the body, that means tiny spots, harmless cysts, old scars, small nodules, and little maybe-something findings that often lead to more testing. And more testing is where the trouble begins. One scan becomes another scan. Then maybe a biopsy, which is when a doctor removes a small sample of tissue to examine it. Then sleepless nights. Then waiting. Then fear. All because of something that may never have caused a single symptom in your lifetime. Most people think, if the scan finds anything, that must be good. Not always. Sometimes finding more means worrying more, not living longer. And CT scans also expose you to radiation. One scan is not the end of the world, but repeated scans add up over time. So what is the better move? If you feel well, skip the idea of scanning your whole body just to look for trouble. Instead, focus on checkups that are actually proven to help. Blood pressure, hearing, vision, vaccines, medication review, fall risk, and the screenings that fit your age and health history. If you do have symptoms, that is different. A doctor may absolutely need imaging for a specific reason. The fix is not, never scan. The fix is, never scan blindly. I once heard from a man in his late 60s who got one of those executive wellness packages because he wanted to be proactive. He walked in feeling healthy. He walked out with 3 incidental findings, which means unexpected things found by accident. None turned out to be dangerous. But for 6 weeks, he lived like he was waiting for bad news. That is a high price to pay for a test that was never clearly needed. Tell me in the comments, do you think people are warned enough about false alarms from scans like this? I have a feeling half of you will say no, and the other half will say, I wish somebody told me sooner. Number 2 is carotid artery ultrasound when you have no symptoms. This is one many older adults have never even heard of until it is offered at a health fair, a mail flyer, or a bundle of stroke prevention tests. The carotid arteries are the big blood vessels in your neck that carry blood to your brain. Carotid artery stenosis means narrowing in those arteries. The fear, of course, is stroke. Now listen carefully, because this is where the sales pitch sounds very convincing. Wouldn't you want to know if your neck arteries are blocked before a stroke happens? Of course you would. But the U.S. Preventive Services Task Force recommends against screening the general adult population for this, If they have no symptoms and no history of stroke or mini-stroke, why would experts say that? Because in people without symptoms, the condition is not very common, and screening creates too many false positives. That means the test tells you something may be wrong when it either is not truly dangerous or may not even be there in a clinically important way. Think of it like dragging a fishing net through a pond with very few fish. You do not just catch fish, you catch weeds, mud, and debris. Then someone has to sort through it all. In medicine, that sorting can mean more imaging, more specialist visits, invasive procedures, and in some cases, even risk of stroke from the very follow-up meant to protect you. Most people think stroke prevention means looking directly into the arteries first, but in older adults, the biggest stroke prevention wins are usually much less dramatic. Controlling blood pressure, managing diabetes, not smoking, treating atrial fibrillation, that is an irregular heartbeat that can form clots, staying active, taking the right medications when they are truly needed. Those are the things that move the needle. So what should you do instead of rushing into a screening ultrasound of the neck? Ask a better question. What specific problem are we trying to solve? If you have stroke symptoms, sudden weakness, slurred speech, vision changes, or a doctor hears something concerning, and there is a real clinical reason, that is different. But an automatic screening test at a fair because you turned 65? That is not the same thing. And here is the mistake many families make. They confuse available with recommended. Just because a test is offered does not mean it is wise. Number 3 is the routine EKG, or stress test, when you have no symptoms and no clear reason. An EKG, also called an ECG, is a tracing of your heart's electrical signals. A stress test looks at how your heart responds when it works harder, often on a treadmill or with medication. These can be important tests, but important does not mean appropriate for everybody. The U.S. Preventive Services Task Force recommends against screening with an EKG in adults without symptoms who are at low risk for heart disease events, because the harms can equal or exceed the benefits. That surprises many people. They think, heart disease is common, so checking more must be safer. But that is not always how screening works. Picture your heart like a car dashboard. The warning lights are useful when something is actually wrong. But if you install a super-sensitive system that flashes over every tiny electrical quirk, you may end up taking apart an engine that was working just fine. That is what can happen with low-value heart screening. A small abnormality leads to another test, then maybe imaging, then maybe a catheter procedure, then maybe medications or worry you did not truly need. Most people think a routine EKG is harmless. The paper itself is harmless. The cascade that can follow is not always harmless. Now, if you have chest pain, shortness of breath, fainting, palpitations, which means feeling like your heart is racing or skipping beats, or a known heart condition, that is a completely different story. Then these tests may be exactly what you need. But age alone is not a symptom. Let me give you a real-life type of situation I see all the time. A woman in her early 70s goes in for a routine visit. She feels okay. No chest pain, no trouble walking. But because she is getting older, an EKG is done. It shows a vague, non-specific change. That phrase alone can ruin your week. She gets referred. Then comes a stress test. Then an imaging test. In the end, there is no dangerous heart disease. But now, she is frightened of exercise, worried every time she feels tired, and convinced her heart is fragile. The body was not the only thing affected. Her confidence was damaged too. And that matters. Fear changes how people live. Some stop walking, some stop traveling, some stop trusting their own body. So what is the smarter fix? If you are symptom-free, ask whether the result would actually change what you do. If the answer is no, the test may not be worth it. In many cases, the better heart checkup after 65 is not another machine. It is knowing your blood pressure, cholesterol, blood sugar, sleep habits, smoking status, activity level, and whether your medications still make sense. Here is a debate for the comments. Do you think more heart testing always means better prevention, or do you think too much testing can actually backfire? I know this one splits people. Let's hear both sides below. Number 4 is automatic PSA screening after age 70. PSA stands for prostate-specific antigen. It is a protein measured in the blood. Higher levels can sometimes point toward prostate cancer, but they can also rise for other reasons, like prostate enlargement or inflammation, and that is where the confusion begins. The U.S. Preventive Services Task Force recommends against routine PSA-based screening for men age 70 and older. That does not mean prostate cancer is unimportant. It means the balance of benefit and harm changes with age, especially when the cancer found may be so slow-growing it would never cause trouble during a man's lifetime. Think of PSA like a microphone turned up too loud. It starts picking up every whisper in the room. Some whispers matter, some do not. But once the microphone catches something, everyone reacts as if it may be an emergency. And the numbers matter here. Research has shown that false positives are common over time, and biopsies can lead to pain, bleeding, infection, and hospital visits. On top of that, some prostate cancers found by screening would never have become dangerous. But once they are found, men may go through surgery or radiation they may not have needed. Those treatments can bring urinary leakage, bowel problems, and erectile dysfunction. That is not a small price. Most people think, cancer found early is always better. That sounds logical. But in prostate screening for older men, the reality is more complicated. Some cancers are aggressive and dangerous. Others are more like very slow weeds in the garden. If you dig up the whole yard for every tiny weed, you can destroy healthy ground. So what is the better move? If you are over 70, do not agree to a PSA test just because it is part of a routine lab bundle. Have a real conversation first. Ask, why are we doing this? What would happen if it is elevated? Would that next step be something I actually want? If you have symptoms, such as trouble urinating, bone pain, blood in the urine, or other concerning changes, that is different. That is not screening. That is evaluation, and it may be very appropriate. Let me tell you about Robert, age 72. Robert's older brother had prostate cancer, so Robert was scared he was next. Every year, he asked for the PSA test automatically. One year, it came back higher than before. He was terrified. He barely slept. He started imagining the worst. A biopsy was discussed. More appointments followed. After careful evaluation, the issue turned out not to be an aggressive cancer. The final plan was watchful monitoring, not panic treatment. But what changed Robert most was not the number, it was the conversation. For the first time, someone explained that screening is not the same as protection, and finding something is not the same as needing treatment. He stopped chasing reassurance through automatic tests. Instead, he started focusing on what actually supported his health day to day. Blood pressure control, walking, better sleep, and keeping up with the appointments that truly matched his risks. He did not get a miracle cure. He got something better. Clarity, and with clarity came calmer decisions. If you are a man watching, or you are watching for your husband, brother, or father, tell me in the comments, do you think men are given enough honest information about the downsides of prostate screening, or are they mostly told, just test and see? I would really like to know. Number 5 is the automatic colonoscopy after 75, especially when you have already been screened and your overall health is changing. This one is important because colonoscopy is a very valuable test in the right person. A colonoscopy is a camera exam of the large intestine, also called the colon, used to look for cancer or growths called polyps. It can absolutely save lives, but after age 75, it is no longer a simple automatic decision for everyone. The U.S. Preventive Services Task Force says colorectal cancer screening from ages 76 to 85 should be selective, not automatic. Why? Because the benefit becomes smaller for many people who have already been screened regularly, while the downsides of testing can rise with age, frailty, and other medical problems. Think of it like inspecting a bridge. If a bridge has been checked regularly for years and kept in good shape, doing a heavy, disruptive inspection again may not add much value if the road itself is nearing the end of use for other reasons. That is not a perfect analogy, but it helps explain the key idea. Screening benefit depends on the bigger picture: life expectancy, other illnesses, past normal tests, personal preference. All of that matters. Most people think, if I did it at 65, I must do it again at 75, and again after that. Not necessarily. For some people, especially those who have never been screened before, and are otherwise in fairly good health, screening later in life may still make sense. But for others, especially those with repeated prior normal tests and major health issues, automatic repeat colonoscopy may offer very little benefit. And colonoscopy is not nothing. There is bowel prep, which can be hard on older adults. There is sedation, meaning medication that makes you sleepy for the procedure. There is the small but real risk of bleeding or perforation, which means a tear in the colon wall. The point is not that the test is bad. The point is that the decision should be thoughtful. Here is where fear often takes over. Someone says, "My friend got colon cancer at 79, so I need this no matter what." But your health story is not your friend's health story. One-size-fits-all thinking is where older adults get into trouble. I remember a very realistic case like Linda, age 78. Linda had already had normal colon screenings in the past. She also had heart failure, meaning the heart was weaker at pumping blood, and kidney problems. Her automatic reminder came in the mail, and she assumed she had to book the colonoscopy immediately, or she would be reckless. But when she sat down with her doctor, they looked at her full picture, not just the reminder card. They talked about her prior normal results, her current health burdens, and what mattered most to her. In the end, they did not rush into a one-size-fits-all repeat procedure. They made an individualized plan. Linda felt relieved, not neglected. That is what good medicine looks like in older age. Not more boxes checked, better judgment. So what is the fix here? If you are past 75, do not treat colonoscopy reminders like a command. Treat them like a prompt for a conversation. Ask about your prior screening history, your current health, and whether the likely benefit still outweighs the burden and risk. And if you have symptoms like bleeding, unexplained weight loss, iron deficiency anemia, which means low red blood cells often linked to blood loss, or a major change in bowel habits, that is different. Then testing may be very important. Now step back and notice the pattern in all 5 of these. The problem is not medical care. The problem is automatic care. The problem is not testing when you have symptoms. The problem is testing because fear, habit, or marketing told you that more is always safer. The problem is not aging. The problem is assuming that once you pass 65, every machine, every scan, and every blood test becomes a smart idea. It does not. Sometimes the most protective sentence in medicine is not, "Let's order more." Sometimes it is, "Wait. Does this actually help you?" Let's do a quick recap, because repetition is how memory sticks. Number 1. Avoid the full-body CT scan when you feel fine. It can expose you to radiation and trigger false alarms that lead to more tests without proven benefit. Number 2. Avoid carotid artery ultrasound as a routine screening test if you have no symptoms. In people without warning signs, it can create false positives and lead to risky follow-up that may not help. Number 3. Avoid routine EKGs or stress tests just because of age, when you have no symptoms and no clear reason. A harmless tracing can start a chain reaction of worry and procedures. Number 4. Avoid automatic PSA screening after 70 without a real discussion. The test can find slow-growing problems that never would have hurt you, while the follow-up can cause real harm. Number 5. Avoid automatic colonoscopy after 75 without looking at the full picture. Your prior screening history, your overall health, and your preferences matter more than a reminder postcard. And if you remember only one thing from this video, remember this. After 65, good healthcare becomes more personal, not more automatic. The right test for your neighbor may be the wrong test for you. Wisdom matters more than volume. Please also hear this clearly. Do not stop medications, cancel appointments, or refuse important testing based on one video. Talk to your doctor before major changes, especially if you take medication or have a diagnosed condition. Natural does not always mean risk-free, and less testing does not mean less care. This video is for educational purposes only. If this kind of calm, evidence-based health guidance helps you, subscribe now. Every subscription helps this channel reach more older adults who are tired of fear-based advice and want practical, trustworthy information instead. And before you go, tell me in the comments which of these 5 surprised you most. Or tell me if you have ever had one test turn into 3 more. Those stories help other people realize they are not alone. And if you want to protect your health even more, watch the next video on the warning signs older adults should never ignore. Because while some checkups are overused, some symptoms should never be brushed off as just aging. That next video may help you know the difference.